Morning everyone. This is Dr. A. Rekha Devi, working as Associate Professor in the Department of Pharmaceutics in Seven Hills College of Pharmacy, Autonomous, Tirupati. Today I will discuss about what is pharmaceutical dosage form and its classifications. Before going to the pharmaceutical dosage form, we should know about the terms drugs and excipients. So, what is drug? It is also known as an active pharmaceutical ingredient. It is defined as a chemical compound which is used or intended for use in diagnosis, treatment or prevention of disease or changes in any chemical excipients. Excipients are chemical compounds also known as inactive pharmaceutical ingredients which are used as a diluent and a binder and a lubricant and also disintegrant and coating agent, preservative agent, stabilizing agent, coloring agent, also flavoring agent and sweetening agent also. So the dosage form is nothing but it comprising of or consisting of a drug and excipient. It may consisting of one drug or more than one drug with any suitable excipient or an additive in the form of preparation is in the form of solid, semi-solid, liquid or a gaseous form. Definition of pharmaceutical dosage form. Pharmaceutical dosage forms refers to pharmaceutical preparations or formulations in which one or more drugs, that is active pharmaceutical ingredients, and excipients, nothing but additives, inactive components, are presented in a particular or specific configuration or in the form of solid, semi-solid, liquid or gaseous to facilitate easy and accurate administration in our body and to deliver the active drug substance through various routes in our biological system. So in this we are having the classification in that solid dosage forms. So there are two types of solid dosage forms, that is unit dosage form and bulk dosage form. In unit dosage form, tablets, capsules, lozenges are there. In bulk dosage forms, powders and dusting powders are there. So next units, what is unit solid dosage form? A unit is nothing but a single. So these they are tablets. Okay. So in units solid dosage forms we are having a tablets. So tablets are unit solid dosage forms consisting of active pharmaceutical ingredient and suitable excipient. They are prepared by compression or molding methods which are intended for administration through oral for local and systemic effect. They may vary in their size, shape, weight depending upon the method of preparation or route of administration or the excipient used or the size of the dose of the drug. So there are various types of tablets like compressor tablets, chewable tablets, entry coated tablets, film coated tablets, effervescent tablets and sublingual tablets. These are the types of tablets. Next dosage form is capsules. They are unit solid dosage forms containing the active pharmaceutical ingredient enclosed in a water soluble gelatin shell or an envelope. So the drug is released when capsule is swallowed and shell breaks when it reaches into the specific area in the GIT. So the shell will broken and drug will be coming out. There are two types of capsules, that is based on the preparation of the capsule, that is soft gelatin and hard gelatin capsules. Hard gelatin capsules are hard and are made from the gelatin and titanium dioxide and comprises of cap and body. Drug is in powder or granular form and is placed in body and then cap is placed over it. Soft gelatin capsules. They are soft and made from gelatin, glycerin and software. Drug is in the form of liquid and it is filled in the during manufacturing and it is also sealed. So the most of the soft gelatin capsules consisting of fat soluble vitamins. Next one is lozenges. Lozenges are tablets formed from hardened base of sugar and water containing the drug and other flavors. They are designed to dissolve slowly in the mouth and release the drug topically to the mouth tissues and throat tissues. They are not be any swallowing. They should be any chewable. lozenges. Next one is any bulk solid dosage forms in that powders. So powders are bulk solid dosage forms containing two or more medicaments in the form of dry or finely divided intended for oral, parenteral or external administration. And it can be intended for single dose use or for any topical applications for several uh, use. The size of the particles in the powders are ranges from the 10,000 microns to 0.1 micron, and size of the powder determines the physical property effectiveness. So we will have an example of growth promoter next. And next one is granules. So granules are aggregation of the fine particles of powders in a mass of about spherical shape. They are prepared to enhance the flow of powder as higher flowability gives better filling of the dyes, that is in a manufacturing equipment consisting of dyes are in containers during the volumetric dosage form. Example, we are having an emulsion. In these granules, again we are having effervescent granules also. For example, when we are adding into the water, it forms an effervescence like an emu. So next dosage form is a semi-solid dosage form. Semi-solids contains both semi-liquids and semi-solid. Dosage forms that are too soft in structure to qualify for solids but too thick to be considered in liquid. They are meant for the topical applications. So in the semi-solid dosage form, example creams. Creams are the semi-solid preparations containing one or more medicaments which are dissolved in the oil or in a water. So the creams are having two types of emulsions like oil in water and water in oil type of emulsions. And in another thing we will have any washable base will be present. All these creams are having the low viscosity and appears mostly in white due to the scattering of the light. So two types of creams, that is oil in water and water in oil. An example for the cream is Penetrix. So it is consists for relief and recovery of the inflammation. Next we are having the types of creams, so that oil in water and water in oil. Oh, we know that an example of Neutrogena Hydro Boost water gel. So it consists is because in this oil, water content is more, oil is dispersed in this water. So oil in water creams are composed of small droplets of oil dispersed in the water as continuous aqueous phase. So they are used in the cosmetics as they are less greasy and more easily washed off using water. Water in oil creams are composed of the small droplets of water which are dispersed in the continuous phase, that is in oil. They are moisturizing as they provide an oily barrier which reduces water loss from the stratum corneum, the outermost layer of the skin. Example of water in oil cream is an Vico turmeric cream. Next one is an ointments. An ointment is a viscous semi-solid preparation used topically on a variety of body surfaces, and the medicated are here two types of there, that is a medicated and non-medicated ointments. So medicated ointments are consisting of a drug and a vehicle. Here the vehicle is a base and they are used for a purpose like emollient to make the skin more pliable, and it is also working as a protective barriers on the skin. And some of the bases are simple ointment is there, that it is acts as a vehicle in which we can go for incorporate any medication. So next one is gels or jellies. This is a semi-solid dispersion system containing a gelling agent in place of these sufficient quantities to impart a 3D polymeric structure. The water, most of the water is present in this 3D, that is three-dimensional polymeric matrix. So all gels and jellies will provide a cooling sensation when applied to the skin, usually translucent and it is non-greasy due to the presence of more amount of water. They are used for the medication and lubrication also. Sometimes lubrication means when we are taking an X-rays or scanning, they will apply some gel. Yes, so that is an examples of this. And next one is suppositories. Suppositories are semi-solid dosage forms. It is a special type which are intended for the insertion into body cavities or orifices like rectum, vagina and urethra, where they will be melt at that particular area and softens and dissolves and exerts a local or systemic effect. So the mainly where we are using this suppository means the suppository may be ideally used in babies or old people who cannot swallow oral medications, or post-operative people who cannot be administered oral medication, and drugs which are inactivated by the stomach pH or enzyme present in the stomach or intestine. Then we can go for using suppositories. Next dosage form, till that is a solid dosage form. Next is a liquid dosage forms. So the liquid dosage forms is a main thing, is a solution. The first one is known as a solution. A solution is a liquid preparations which contains one or more soluble drugs or chemical substances dissolved in a suitable or specified solvent. They are useful for hygroscopic drugs which must be administered as a solution, and they are useful in the children and also patients who cannot tolerate a solid dosage form. Like in pediatrics or geriatrics, you can use these solutions. So an example of astaline is this. Astaline is nothing but a salbutamol which is used for any asthma conditions. Next one is syrups. Syrups are concentrated aqueous preparations of a sugar or sugar substitute with or without flavoring agent and medical substances. So sometimes we will have a drug or if you are having a drug, for example, if you are having a drug that is known as a medicated syrups. So medicated syrup consisting of a medicinal agent like a paracetamol syrup. So the drug is a paracetamol. Another one is flavored syrup. So it doesn't consisting of any medicinal agent or any medicament. It will be used for only flavors or to mask the unpleasant taste of the medicines. So that is known as flavored syrup. Elixirs. Elixirs are clear, sweetened hydroalcoholic solutions which are intended for oral use and are usually flavored to enhance the palatability, means the tasting of it. They are usually less sweet compared to the syrups and less viscous also. So they are classified into two classes, again medicated and non-medicated. So medicated is consisting of a drug and it is used for the therapeutic purpose, whereas non-medicated it consisting of the vehicles only it acts as a base for the preparation of the medicated. Next one is in a biphasic liquid dosage forms in which we will have in a two phases. So that is known as a biphasic. Emulsions. Emulsions is a mixture of two or more liquids which are normally immiscible. So these are consisting of two phases consisting of the liquid drug substances. When the drug is not soluble in a suitable solvent, then we can go for selected emulsions. Emulsions are homogeneous biphasic liquid dosage forms. They are classified into so many types like oil in water, water in oil, and multiple emulsions, micro emulsions, and nano emulsions. So emulsions can be administered orally, topically, intramuscularly, like as an injections. And the next one is a suspension biphasic dosage form. It is a heterogeneous system because it consisting of the solid particles and which are sufficiently large for sedimentation and which are insoluble in that particular solvent. So it is a heterogeneous. Hetero means solid and liquid is there. So it is a heterogeneous form. So a suspension consisting of a dispersion of relatively coarse particles, and usually most of the solvent used is in water. So that is an aqueous vehicle. Suspensions may be used for oral and topical administration. Like solutions, oral suspensions are useful for both children and patients who cannot tolerate solid dosage forms, or it is a pediatrics or geriatrics use. And the last dosage form is a gaseous dosage form. So it is in the form of gas. So mostly we know that an inhalants. So inhalations. So inhalations are finely powdered drug substances or solutions or suspension of a drug substance which are administered through a nozzle or oral respiratory route for the local or systematic effect. So systemic effect. So systemic effect is nothing but it will act on total body. Local means in that only in that particular area. Here to facilitate administration, we have to use a device known as special device. This device is called as an inhalers. Mostly you can observe in the patients those who are suffering from the asthma or pulmonary diseases, we can able to see in inhalers. Example, Ventolin inhaler, salbutamol, and aerosols. So the aerosols is a type of gaseous dosage form. It is defined as a system which depends upon the power of a compressed gas or liquefied gas to expose the what are the contents present within the container. So what is pharmaceutical aerosols means? This pharmaceutical aerosols is consisting of a active ingredients which are dissolved or suspended or emulsified in a suitable propellant or a mixture of solvent and propellant, and which are intended for oral topical administration or for administration into the eye, nose, ear, body cavities like rectum and vagina. Thank you.